I want to welcome everybody to our community town hall. This is intended to be a conversation about the vaccine. Quite frankly, we know last week we started receiving the vaccine, and it represented hope, or like I've been saying, hopefully light at the end of the tunnel to start moving past this horrible pandemic that's wrecked our lives, that's changed the world, starting in February of 2020. Luckily, we have some of the best and the brightest to talk to us tonight and educate us on the vaccine. We know that our communities of color, our Black and brown people, need to be educated on why it's important to take the vaccine. And again, I'm so honored to have such a distinguished panel. I'm going to jump into a few introductions, and I will also just state these bios would be abbreviated because these are highly accomplished people, but we want to make sure we spend time talking about the safety, the efficacy of the vaccine, so we can make sure we're armed with the right information to make our decisions going forward as it relates to the vaccine. I'm going to start with Dr. Oniemma Agbagu. He is an associate professor of medicine at the Yale School of Medicine in the section of infectious disease. In response to the COVID pandemic, he is also the Yale principal investigator on multiple investigational, therapeutic, and preventative clinical trials for COVID-19, including remdesivir, as well as the Pfizer-BioNTech vaccine trial. Tisha Johnson. Tisha is the Deputy Director and Chief Operating Officer of the Yale Center for Clinical Investigation. Ms. Johnson is nationally recognized for her expertise in the design and setup of clinical research. She has served as chair and co-chair for National Clinical and Translational Science Award consortium groups and committees. She is also an external scientific advisor for NYU, Universities of Washington, Oregon, Florida, and Buffalo. Bishop Benjamin Watts. Bishop Watts is the senior pastor at Shiloh Baptist Church here in New London. Bishop Watts is a graduate of Harvard Seminary, as well as a graduate of the Yale University of Divinity School, where he received a master's in divinity. He is the director of Black Ministries Program and a faculty associate in the religion and community life. Representative Anthony Nolan. Representative Nolan is in his first term as a state representative, serving New London in the 39th district. He spent his entire life in public service. He served in the U.S. Navy and continues to work on the New London Police Department. Mr. Nolan was awarded the NAACP Freedom Fund Award, the NAACP Danny Jenkins Memorial Award, and the Rotary Club of New London Unsung Hero Award. And I'm going to introduce our Chief Medical Officer, Dr. Oliver Mayorga. He's joining us tonight. And I'll ask Tisha to introduce our clinical ambassadors, and then we'll jump into the conversation. Tisha?
Thank you, Patrick, and thank you for convening this forum. I'm going to have 4 ambassadors with me. I think 2 are still transitioning over, but I have Ms. Sandra Trevino, and Sandra is the former executive director of Junta and a cultural ambassador, and Shayla is the director of social services for Junta for Progressive Action, which is a local advocacy organization here in New Haven, but actually with statewide reach that focuses on Hispanic, Latino, Latinx services. I'm going to be joined by also Reverend Leroy Perry and Reverend Elvin Clayton. Reverend Perry and Reverend Clayton are both pastors with the African Methodist Episcopal Zion churches, and all 4 are cultural ambassadors to clinical research at Yale. They've been partnered with us for 10 years, and the goal of the partnership has been focused on providing clinical research awareness and supporting diverse participation in clinical trials. So thank you. And again, thank you for having us join.
My pleasure. Dr. Mayorga, can you give us a brief overview of the current state of the cases in our state, in our community?
Sure, happy to, and greetings everybody, and it's an honor to be on this panel at this very important town hall, so thank you, first of all. So yes, I'll give us a brief high-level overview of the total cases that we're seeing in the world and nationally, and then we'll bring it down closer to our local community. So as of this morning, worldwide confirmed cases are at north of 76 million and continuing to climb. And cases in the United States actually are at about 17.6 million and continuing to climb. New cases in the past 24 hours in the United States are over 200,000. So that is the breadth of this pandemic. Now, locally in Connecticut, we've actually seen in the last 24 hours 2,680 new cases. So quite a few. Within our own hospital, what we're seeing actually is at this very moment, we have, let me just take a look, 27 patients actually hospitalized within our community in our hospitals. Some of them are in the intensive care units. Most of them are actually in our medical floors. However, certainly many, many more in our communities that actually have COVID and are suffering from COVID. I will also share, and the reason for this town hall also is our COVID vaccines have been distributed and will continue to be distributed. And we at Lawrence Memorial actually began vaccinating last week on Wednesday, was our first person who was vaccinated. And at this point, we've vaccinated at least several hundred healthcare workers at Lawrence Memorial, and we'll be soon working with the state on the process to actually roll out the vaccination process to our community. So thank you.
Excellent. Thank you, Oliver. Oniemma, the vaccine is here. Can you describe why it's so important for people in our community to get the vaccine and maybe address any of the past skepticism that may be out there within our community as it relates to vaccines?
All right, can you hear me? Okay, great. Okay, yeah, so thanks for the opportunity. Thanks for having me, and it's great to join our group to discuss this really critical and timely issue around COVID-19 vaccines and our communities of color especially. You know, I think I just want to reemphasize a few things. I think that we know the critical importance that vaccines play in all our lives from a public health standpoint. How they both prevent disease, killer diseases, essentially, and also how they protect us, right? Keeping us healthy and not sick and out of the hospital. And I think for the COVID-19 pandemic that has really, altered everything, that, every aspect of our lives. I think that we've seen the limitations of, public health interventions and the cost of those interventions, including being able to have people wear masks, social distance, etc. And so I think that it's universally accepted that the way out of this is through a very highly effective vaccine for COVID-19. I think we've all been party to just how quickly things have gone in a positive sense, moving from an illness that we knew very little about earlier on in the year to now having both approved treatments, even though realistically the treatments we have are really just have a modest effect at best, frankly. And now having more than one really highly effective vaccine with results that were way beyond what any of us could have initially guessed or expected or imagined, which is great. We've all seen the data on the vaccines as to just how highly effective they are. 95% is a home run for a vaccine for infectious disease. It doesn't get any better than that. But and we've seen that the vaccines are safe. The first wave of vaccines that have received emergency use authorizations have shown at least decent short-term safety profiles and efficacy across the board, across ages. So, older individuals tend to have much less response to vaccines in general because of just the ability to generate an immune response. We found that the vaccine was highly effective even among older individuals aged 65 and older. We know that across race and ethnicity. So, the Pfizer vaccine trial, for example, had 10% Black individuals, about 26 or so percent Hispanic individuals, and we found that the efficacy remained the same across racial ethnic lines. And so we know that the vaccines have started, been rolling out. Pfizer's a week ahead of Moderna. And I think as of last week in the US, there's about 272,000 people, the minimum, who had received the vaccine. The UK was also a couple of weeks ahead of us with the vaccine as well. Those numbers are important because beyond the clinical trial populations, it's now something that's out there for use by many individuals. So one of the concerns, and I think the next frontier with vaccines, would be to reap the maximum benefits of having highly effective vaccines. And we know that translating the highly effective vaccines to real world effectiveness will be dependent on one big factor, and that's people having trust and faith in the vaccine uptake, so that way we can start to build or head towards herd immunity, which is how we start to really get beyond this pandemic. And I think, it's preaching to the choir, as we say, but we know that vaccine hesitancy is a big problem. I know the World Health Organization even mentions it as one of the top 10 public health threats. And that's, just the way people view preventive modalities like vaccines. And I think it's come to bear quite significantly with the COVID-19 pandemic. There's been some rays of hope. I think we've seen that the public polls and even scientific polls around people's willingness to receive the COVID-19 vaccine has improved recently. At some point it dipped less than 50%, but I think more recent polls have started inching up to the 60, 70%. But as you're all aware, those numbers are not uniform across different groups. So we know that Hispanics and Black communities of color tend to show greater vaccine hesitancy or unwillingness to receive those vaccines. And I think for Blacks especially, that number is quite low. At some point it was as low as 25%, we're excited to receive the vaccine, but those numbers have creeped up recently to about 40% or so. Now, there's a mismatch between the populations that are disproportionately impacted by COVID-19 and those who are willing to accept an effective vaccine. And I think that there's huge work to be done to bridge that gap. So we know that, communities of color, for so many reasons, get infected with COVID more, are hospitalized more, and die more at a magnitude that's greater than our other, white counterparts. So, I think that now is the time more than ever to start to think about ways to make inroads into communities of color to ensure that we can maximize the benefits of the effective public health interventions. Last thing I'll say is that I think that we only begin to address these when we listen more to people. We think about the messages and that we send out and how to send out those messages, who are the trusted messengers within communities who should carry this message about vaccines, the role that role modeling plays as we participate ourselves in receiving the vaccine, and what that means for our communities. And I think that those are critical issues to address. We all know the reasons why there's hesitancy within our communities, the past injustices, the health inequities, so many of those structural things that are way above my pay grade. But I think that at least by highlighting them, talking about them, and chipping away at them, we can start to restore faith in our communities around participating in scientific research and benefiting from scientific research. So I think I'll stop here. Thank you.
Thank you. Thank you for that. It was very, very insightful. Representative Nolan, representing 39th District here in New London, what are some of the feedback and some of the questions that you're hearing and maybe we could start to chip away at just what Oniemma just described, some of the hesitancy from people in our community.
Well, first, good afternoon, and thank you for all for coming together for this great discussion in regards to vaccine. I'm finding a lot of our neighbors, our friends, people in the community, they're a little hesitant to trust the government in regards to the vaccine. I have many people that are waiting for me to take it so they can take it. And I also have a little worry in regards to vaccines, just because of the ways that, you know, people of color were treated in the past. And that was one of the biggest reasons why I thought that coming together with such professionals as everyone here to try and get our community members to understand, you know, a little bit more about it. So breaking the comfort or the discomfort for people to be able to have trust in it is the most desired answer that I'm getting, or questions that I'm getting from constituents. So, you know, that pretty much would cover the majority of the questions, I think, just getting some explanations in regards to that.
Sure, sure. Oniemma, Tisha, I don't know if either of you like to jump in.
Tisha, you want to go first? I'm happy to
Sure.
say something.
So, you know, we have faced this, as I mentioned, we've been at this for about 10 years, really focused on this issue of mistrust in research. And there are valid reasons that people have this mistrust. The history is there, but I think the really important message that we should relay to everyone is that those incidents, so Tuskegee, Henrietta Lacks, all of those things have led to regulatory changes. And so regulatory changes exist because those things happen. And with those regulatory changes, we know that things are very different. The structure of the review boards that review the research locally, all of those things, they have community representatives, people who are from the community, who look like us, who sound like us, who are a part of the review process, in making sure that anything that we do locally is appropriate and relevant. Here, we're lucky to have our cultural ambassadors, which is another layer for us. We have a partnership with the community, really understanding the concerns of the community and messaging around the community. And then I think the other thing that's really important to say is the Oniemma, as Patrick mentioned, was the principal investigator of the Pfizer study at Yale. So as a physician, as a researcher, as a leader, he actually led our data collection here. And so, you know, there's lots of other investigators around the country who are minorities who took part in this. And I think getting that message out, that there are people of, you know, Black and brown people who are intimately involved in the review process, intimately involved in the process for how these drugs and devices and vaccines come to be. And also that there's a very rigorous regulatory approval process. And I know that that's a hard thing to trust with hearing the news and watching CNN sometimes, but just know that the scientists, I think people who actually watch the vaccine review, there were scientists, there were doctors, there were public health professionals who were questioning, who were looking at the data as an independent body. And those are all parts of the safeguards that exist in research now. And that's what makes things different. And so I think for those of us who are in this position, I think part of our jobs is to listen to the community, to definitely listen to the concerns, but then to provide accurate, concise, clear information, and not just from people like Oniemma and Patrick and Oliver, who are part of the healthcare structure, but combined with the community leaders like yourself and our cultural ambassadors, so that the messengers, the trusted messengers, are getting the information hearing it directly, getting all of your questions answered so that you can stand up and say, hey, I'm willing to take that vaccine because now I have all the information and I truly understand how this research was done, how this research was approved, and what that process is.
Can I just add a line or two?
Please.
Yeah. So, as someone who's conducted clinical trials for a while, I think that, and this is what I always say, clinical trials is both a science and an art. And I think the art part of the scientific work we do is recognizing that we're dealing with people, we're dealing with human lives, and we're engaging people. And so I think, one of the beauties I've had with directly working with the cultural ambassadors is learning just how powerful relationships can be. And I think that that's been a very great forum. I hadn't worked with the cultural ambassadors before the vaccine trial. So this was a welcome introduction to me. I've had my own ways to make inroads in the communities. I do HIV research. And so, I've learned to spend time, for example, in AIDS Project New Haven, to attend community events. That's how I've been involved with, the community that I research primarily. But I think that, the model of, the Cultural Ambassadors Program, where you can involve the community in all phases and all stages of research, and to the point where if you've built those relationships and you've done clinical trials in the past, it's so easy to do the next one and the next one and the next one, because there's already established credibility between the scientific community, the health system, and the community. So I think that that's definitely something, we need to work on, not just for the immediate benefits, but something that we need to build on and build those bridges that will continue to yield dividends many, many years down the road. So even beyond COVID-19, God forbid there's going to be another hit in the future. If we build those relationships now, we'll be better positioned to do that better. Underrepresentation in research hurts us, because one of the questions we will eventually ask whenever there's a new device, therapeutic vaccine, like Tisha said, is, does it work for us? Does it work for people that look like me? Does it work for people, with my characteristics? So it's kind of like lose-lose, because if we don't participate in generating data on if things work in us, then when those things are approved or they're available, then we can't answer a critical question. Does it work for people like me? So there's a lot of work to be done. And I think this is really just highlighting, just the things that we need to focus on. So that's what I wanted to add.
That's great. That's great. You talk about research, Tisha, let's hear from some of the ambassadors on how they've been championing exactly what Oniemma just described.
Maybe I could ask Reverend Perry and Reverend Clayton to start, since they actually, in addition to being ambassadors and messaging about the study, they actually participated in the vaccine study. And also, I want to throw out Patrick. Oniemma's participation at our site was 41% from underrepresented populations, and I think if we had a little longer, we would have topped 50% here. But he did a great job with the ambassadors of making sure Connecticut's participation was very representative.
That's great.
And Reverend Perry or Reverend Clayton, would you like to comment?
Tisha, I'll begin because I have another meeting, but I'll come back a little later. But I will say that the importance of being a part of the vaccine is crucial for people of color. And I myself was a part of the vaccine study. And I also asked my wife to be a part of the study. So I get a star in my crown for getting my wife to be a part of this study. But what I shared with her is that science proved that we were in phase 3 of the study at that time, and it was very promising that about 90% effective, and she agreed to get on board, and we've been sharing this news and sharing the fact that we need to make sure that we get as many of our people vaccinated as possible when it's available. And like I said earlier today, she didn't just take my word for it. She asked our niece, who is the medical doctor, what did she think about it? And she gave us flying colors, and her sister, who is the physician assistant. So this work is moving in the right direction because we believe that the community at large have been working with the ambassadors and Yale for over 11 years. So we didn't just come on the scene when COVID came on the scene. We've been around throughout the years sharing news and information about clinical research. So therefore, the trust has already been built. It has been built because we're pastors. You know, we're baptizing the children, we're marrying the young adults, and we're burying the dead. And so and we also have conversations in various things in terms of life and community. So we have done the best that we can to try to share this great news for the vaccine.
Thank you, Reverend. Reverend Perry?
Yes, sir. Patrick, I'm so happy to be on this show with you. I watched you on another show, so I see you keep popping up, bringing us these town hall meetings, and I'm so pleased at the work that you're doing. I know it's not easy, and you have to be committed to do this kind of work. So to piggyback on Reverend Clayton's comment about the YCCI ambassadors, we were brought into this this form of work through Tisha Johnson and through one of our presiding elders who said, Tisha wants to see if she can get you guys to help recruit people for research studies and clinical trials. And we said, hell no. But we did have the smarts to say, okay, we will listen. Let's see what she has to say. And so once we started to listen and once we started to see the disproportionate number of minorities involved in clinical trials and how that affected the outcomes, not only in our community in terms of who got the vaccine first or who got, you know, a part of a study, who benefited from this and who didn't. And we realized that we had the ability to partner with Yale so that we could pick out in the community issues that were critical to us, like sickle cell or prostate cancer, breast cancer, asthma. And so we started this partnership. And part of our partnership was contingent on the fact that we would get training. So at least many of our ambassadors also got over 1,500 hours of training. Plus we've got certification for community health workers. And so our technique has been to say to people who have, when they say they got sugar and they want to get cured, we don't have to say, see Jesus. We can say, there are research studies that may be able to help you and help all of us. And so we outreach to our churches and to our communities, the barbershops, beauty shops, convenience stores, bodegos. We also have a newsletter we put out. We do town hall meetings with community leaders and with religious leaders. In fact, we have a program right now in Branford where the Branford community wanted to know how they could reach out to marginal people. And so we started a whole process with the flu vaccine, and we're working with them even today on information with regards to the virus or the vaccine and the virus. As Marcelo Nunes says, it's one or the other. It's the vaccine or the virus. So we might as well get down to brass tacks. And let me also say about Oniemma, we enrolled people from our churches in the study. They all had his cell phone number. If they got a cough, a cold, a hiccup, he would answer the phone. I was glad because I was tired of them calling me. I said, call him, he's the doctor. And he immediately, he with, you know, he's just a calm person and rational person. And he was, so having people like that helps us to get this message out. But again, we have to educate. We have to re-message sometimes the message. We have to also be willing to put ourselves at risk to demonstrate the trust that we have in the vaccine, that others might trust that same vaccine. So that's what we've been doing, and we just didn't get started. We've been doing this for a while.
That's excellent. Thank you so much for sharing that. We do have a question that came through the live chat, but I want to jump into some of the other general questions real quick about the vaccine. Side effects, what and why is it a two-step process? Oniemma, would you like to take that one, or Dr. Mayorga? Could I ask Oniemma if you could start, please?
Sure. Okay, so the question was why it's a two-step process, why it's a two-dose vaccine. So it became pretty clear early on in the early phase studies, so the phase 1, phase 2 studies, that the first vaccine didn't generate the maximal response or achieve what we thought should be the target range that should protect against the disease. The comparator, the bar, was the antibody levels in people who recovered from COVID. So you wanted you to get the vaccine, and you wanted the immune antibody levels to look like those who recovered from COVID. So it became pretty clear that after the second shot, that's when the levels went up. So that we think that two-dose schedule does two things. One, it gets the protection where it should be. And even though we don't have all the data on how long the protection would be, but that second dose is important. So I hope that was the answer to the question. For side effects, so first of all, I always like to preface it, right, that everything has side effects, okay? And in some cases, those side effects are in some ways desirable, and I'll explain that in a little bit. So the two side effects we look for in two big categories are what people feel at the site of an injection when they get a vaccine, but also the body's systemic response to the vaccine. So things we collected were things like pain at the injection site, redness, swelling, etc. And then also for systemic side effects, fever, headache, muscle aches, just the usual thing. Now, many of you would, or at least those of us who try to convince people to take vaccines like the flu vaccine, people tend to say, when I get the flu vaccine, I get the flu. And that's a good way. I use that to explain to people that when you think you got the flu, what it really is that your body is responding to the vaccine. You remember that the vaccine introduces something into your body that tries to rev up or ramp up your immune system, so that when you see the real thing, your immune system is ready, set, and prepared to protect you against it. So we noticed that when people get the second shot, there's a little bit more of those systemic side effects, and that coincides nicely with having that boost in antibody levels. So the first one primes, the second one boosts the immune response. So the message here is that side effects are and should be expected with the vaccine. For the vast majority of people, this would be mild, okay? And typically resolved within the first 2 days, 2 to 3 days of getting the vaccine. And many times it really just reflects your body's responding to the vaccine. Now, for the Pfizer trial and the Moderna trials, the first two that have been approved, there actually haven't been any serious safety events. So these are deaths related to the vaccine, hospitalizations related to the vaccine. So there were no serious adverse events that we detected that even caused us pause at any time to have to hold the study or discontinue it. So, the safety profile is pretty good. And, the message there again is that, you could have some discomfort, but that's just, your body responding to the vaccine.
Thank you. This is a question that came in through the live chat, and it's more of a comment, and if any of our ambassadors can address this, if you know anything about this. Within segments of the community, the concern is much politically fueled, which has turned into suspicion of the research environment. Many immigrants are fearful that this is a phishing attempt by ICE to to harm them, or it's a phishing attempt by ICE. Their health is our health. Until we can fully address theirs, ours is also in danger. Anybody want to attack any suspicion from immigration authorities to some of our immigrants who are looking to potentially look at the vaccine or participate?
Could I ask Sandra or Shayla, this is an issue that they address often when speaking to their community about even our research studies. So Sandra or Shayla, would you mind
Yeah,
sharing your perspective?
I definitely, I'm Shayla. I definitely have here, yeah, mistrust from the government, and so many reasons that they're, waiting back on to see, pretty much like, let's see what happens. Let me at least give it some time and see what happened. There's some people that are like, not against it, they're not gonna do it, just to wait. And there's people that are saying, I'm not. That's why I really think that that it is information. It's important to get information and facts, but there's so many things out there going, and some of them are not really facts in the social media and everything. So that's why I think it's just so important to get information, accurate information, clear. But yes, there is a lot of worry. I don't know if you want to add, Sandra, but there is that.
So over time, we know that the government and certain anti-immigrant groups and hate groups as well have used the fear tactic when it comes around research, health, or just social resources out there. That's only going to increase as there's a lot of misinformation, misconceptions out there about the vaccine. At the end of the day, I mean, we just got to continue to talk to our communities, continue to build that trust, and provide them with accurate knowledge. That a lot of these, groups are just putting out this information to continue with those fear tactics that we have seen over the decades. That's nothing new.
Thank you.
And Patrick, if I could add, I think it's really important for all of the leaders to message that from a healthcare perspective, that all patients within our system are treated fairly. There's no connection to ICE, and that what our primary concern is from a health perspective, from a wellness perspective, and from a research participation, which is the side of the organization that we deal with, that at no time is your immigration status a part of the conversation. What's a part of the conversation is, what are your needs? If it's related to research, it's an honest conversation explaining you to the study. It has nothing to do with race, ethnicity, status, or any of those factors. And so I think that that's a really important message. And I think it's a important message that maybe Oliver and Oniemma could speak to clinically, because I think we have sometimes the same concern with just coming to the ER. And these are really important messages to get out, to let people know that this is just not the case, and there's no connection, and you're safe to seek care, to seek the vaccine.
Thank you for pointing that out, Tisha. You're spot on. One other question that came in, does the vaccine have less potent effect with people with autoimmune illnesses such as lupus?
Short answer is no. But if individuals with autoimmune conditions are taking medications that can affect the immune system, a very common example would be steroids. So if you're taking high doses of steroids, that sometimes can blunt your response to vaccines. We did exclude people, or did not include people who were on high doses of steroids in the clinical trials. But as you can see, that in the emergency use authorization by the FDA, they did not restrict it to those individuals, but they did put a caution in the product labeling that if you're immune compromised, that you could have a little bit of a diminished response to the vaccine.
Excellent. What about people who have had cancer or going through chemo? Are there concerns about the vaccine as it relates to those individuals?
Yeah, so that would fall. So, when we use the term immune compromised, it's broad. Okay, so forgive me, everyone here who is above the age of 65. You know, in some ways you're immune compromised. Young kids are, pregnant women are, cancer chemotherapy people are, people with HIV and stage renal disease, you know, autoimmune conditions on medications, certain biologics, you know, for treating Crohn's disease and some of those things. So it's a broad range when we use the term immune compromised, it's a broad range of patients. But like I said, even though we do recognize that the immune response to the vaccine could be blunted, you know, it's still recommended for, you know, those individuals, probably except pregnancy, but, you know, for all the other groups to receive the vaccine. And like I said, we're encouraged, at least for elderly individuals, that the vaccine had the same efficacy than it had compared to what it was in younger individuals.
Thank you, sir. There seems to be a growing trust for one vaccine versus the other amongst subgroups and communities of color. Will it be possible for an individual to select one versus the other compared to the Moderna versus the Pfizer?
I'm happy to keep talking. So Pfizer and Moderna are the same thing. I'm not going to parse things here. They're both messenger RNA vaccines. One message I've always given is that both of them were new vaccine technologies, but the fact that they were two different studies conducted differently in different groups, different areas, but showed the same results validates the technology. So the Pfizer vaccine validates Moderna, Moderna validates Pfizer. You can almost superimpose on each other their results. Each one showed almost 95% efficacy. So messenger RNA vaccines are welcome to the club. They're here to stay. So they're both fine. There's storage requirement differences between Moderna and Pfizer. So maybe in parts of the state where they don't have capacity to have sub-zero freezers and things like that, maybe Moderna will be more accessible so that way it can be stored and not expire, if you will, but they're comparable. Now, the Moderna vaccine actually showed a little bit diminished response in older individuals compared to Pfizer. So I'll put a note there. So if you're 65 and older, I definitely would recommend Pfizer above Moderna because the older people did not do as well with the Moderna vaccine. But otherwise, both of them are very well tolerated. They both work well. And frankly, choice is a luxury. I think now it's get what you get. Maybe many, many, many months down the road, we'll be able to have the luxury of saying, I want this above the other. For now, take what you get.
Excellent. Bishop Watts, what are some of the questions or concerns that you're hearing in the community around the vaccine? And
yeah, I really appreciate the conversation, and thank you, Patrick, for inviting me to be here. You're an exceptional leader and a credit to this community, and I think it's very helpful to have this dialogue. I think a lot of what I've heard, just a couple of things made me a little nervous, and I just wanted to hit those. And what we have always struggled with in the African American community in particular, and Black and brown people collectively, is the ethical and unethical medical research. And an acknowledgement of that is important so it can be separated from this vaccination conversation. You don't need to chip away from that. Just acknowledge it. The validation of that allows people now to take value in what you say next. Because if you can't at least acknowledge a fact, you see, in the past, we did not know if it was mythological that there were night doctors going into slave camps and doing medical research. We did not know whether bodies were being exhumed for research, but we later came out to prove it as fact. So a lot of things now, which were mythological and stories told anecdotally in Alabama about the Tuskegee experiment long before it became known, now we know are fact. So what we have to do is just simply say, this happened. Henrietta Lack happened. The HeLa immortal cell was used without her permission. Fact. Now, that does not take away from the efficacy of good research done by reasonable, responsible, respectable scientists that have done this and were not just working on this, but have been working on this type of research for years, and it could then be expanded, which accelerated the rate of which we've been able to reach this point. But if we at least acknowledge and validate, that now puts everybody at ease that you're not trying to put something over on me, or in the words of Malcolm X, I'm not being bamboozled and you're not running amok. We have to say that up front, because if we're ever going to get out of what James Weldon Johnson called the gloomy past, it is an acknowledgement of it that brings light to it. We're not trying to hide it. And now let's proceed forward. That way, we can now start chipping away at what really is the problem, and that is the distrust. The distrust born out of truth now can be worked on, because the relationship basis is now based in honesty, and now we can have a viable conversation that says, here are some things I can give you, and I'm being upfront with you. And all of you are great ambassadors for that, because you're articulate. I believe everything you said. It sounds plausible. If you were selling ice, I'd be buying today, even though I don't need any. But we start out with, I guess, I want to have a nice, honest basis for the dialogue. And that helps. And I appreciate those of you that mentioned it, but don't just mention it casually. Let's say it up front and then say, here's the elephant in the room that has created this monster of distrust. And here's the truth of where we are today, and particularly this vaccine. And here's how it adversely affects you to hold on to fear. Because if you hold on to fear, you're being adversely affected by the health disparities that have created the gap between those that have and those that have not, the insured and the uninsured. So you're already adversely affected. Don't be adversely affected by pushing yourself to the back of the line when you're dying quicker because of the comorbidities than the rest of society. So don't allow yourself to be put into a new okie doke of now disinformation to keep you back while others push to the front. That's my addition. Thank you.
Thank you. Reverend Perry.
Yes, I think that is spot on. And one of the things that we tried to do in our newsletter was to highlight some of the works of Harriet Washington's medical apartheid, issues that dealt with plutonium, how prisoners, Black men in jail were used in experiments, and the grave robbers. But I realized that, we got a generation that's really media savvy. And along with that, when you're watching television and they say to you, oh, this drug, if you've ever taken this, you may have gotten cancer. So now we need you to come forward so we can litigate for you. And so I think a lot of people are saying, you know what, I'm afraid to take these drugs because later on they may come to find out that they are harmful to us. And so why should we trust the medical community? So again, I think that, in our case here, because we are at the bottom, we have few options here and with regards to whether we take this or not. And when I was watching, I think the NAACP's town hall, they were talking about if our community fails to take the vaccine, we may eventually be left out of the process and just be forgotten, and our communities could just evaporate, rather than where other communities may prosper or go back to building better and best, we may still be at the bottom. So it's important that we just get the message out that, we got to reach the people at the bottom if we're going to change the people at the top.
Patrick, if I may, just building on what Bishop Watts and Reverend Perry just said, I think it's so important to, to have that moment to acknowledge that these things did happen. But here is how today is different, and be able to move the conversation. But I think it's one of the things that, and Reverend Perry shared in the beginning what happened when I asked them to come meet with me. They did say no, and Sandra said no, and Shayla said no. So everyone, it was a unanimous no in the first meeting. But what changed is the conversation when I talked to them, and so it's very public now. There's a an FDA, it's called the drug snapshots. And so if you go to the FDA drug snapshots website, you can see for every drug that has become approved, you can see the rate of participation by underrepresented groups. And the reality is, as Oniemma said, as Reverend Perry said, that understanding that fact that if you're, if we don't have the data, if we don't have people who are willing to participate in clinical trials while a drug is going through an approval process, on the back end of the process, it's very hard to know for physicians, for doctors, for leaders, to know whether they really work. And so I think that it's really about what the ambassadors have done as trusted members of the community to get the information themselves, because they did. It was not an easy process. Bishop Watt's session on Henrietta Lacks and on Tuskegee, that session in their training is about 4 hours long. So it's really in depth, and we're getting the information and they're understanding both what happened there, but how the law has changed. And I think that that's a really important part of this message for all of us, is that there is a regulatory process, that those things did happen, but here's how we're beyond that. And here's the value of someone like Oniemma saying, here's how I have to, the standards for which I am conducting this research. And I'm standing behind it, and I'm able to tell you what I witnessed as an investigator, and then the data that's been shared with me as a physician, so that I know and I have the trust. And I think it's for everyone. It's get the information that makes you comfortable, but this is a critical time. And Marcella, we won't steal her line, but she did. It's your choice is the virus or the vaccine. And we really need to make sure that everyone has the information that they need to make a good decision, but that is the choice. And I think that we really have to just be so clear about that message, that we need to make sure everyone is very focused on that message, and that they get whatever information they need so that they can make the choice for the vaccine.
Can I add something to that? I also feel like the community is really reaching out, at least to myself, in regards to wanting to know more information regarding the vaccine, and so that they're more proactive in that sense. And I truly believe that that's because the landscape has changed in regards to how research is now being discussed in our communities because of all those years of hard work.
Thank you.
Yeah, can I just make a comment about how people consume their health information? I think that one thing I've learned, and I think many of us may have witnessed or maybe appreciated more than historically, is just how much information people consume from, social media and information sites. So trust me, we are way behind the curve around positive and appropriate messaging around the vaccine. Every day there's a new video clip sent to me, or some, trusted authority who doesn't have credentials. And sometimes it's so infuriating to listen to people sound so confident, who have zero credentials in the medical field, who have no clue what they're talking about. But for some reason, those viral messages, tend to spread rapidly, and unfortunately tend to be the way many people consume health information. So I think, we just, again, it's not just the medical community communicating research and science, etc. But I think those of us who have a vested interest in public health in our communities, I think we need to almost relearn how to, talk about important issues of the day, how to send out messages to an audience of young people who spend all time on their phones and their tablets, don't watch the CNN that you and I watch, don't read any newspapers, So there's a whole new paradigm out there. And I really think we're behind the curve. And I think even for our communities, we need to start putting out messages in the right fora, and where people would see them, trust them, listen to them, consume them, and start to recognize that, there's almost literally a war between the negative messaging that's out there and what's appropriate.
If I can add something to what you just said, Brother Patrick, I just want to add this. The way in which you phrase that is almost very too polite, because I think there's a secondary problem. And I think there are nefarious actors out there that are racist, hate groups that are also interjecting other messages. They're the messages going to the Latino, Latinx communities, telling them to worry about ICE so that they don't get vaccinated, telling them to be afraid. Those messages coming to the Black community, reminding them of these things that have happened with unethical medical practices, again, for the same purpose. So I think that we have a part of what that bill should have been through the Senate needs to be this new publicity campaign that has to be played on Twitter, has to be on Facebook, Instagram, it has to be on TikTok, it has to be on a new platform, because those nefarious actors are doing it, I think, and this is only my opinion, with the express, looking for the express result of having a deleterious impact on Black and brown people's lives in general. And that's why information like this from trusted sources like yourselves is so important to get out.
If I could just say one more thing, Patrick, that is, we realized because when we started 10 years ago, we were 10 years younger, and reaching out to younger people now there's a gap between where we are and where they are. So we initiated a program, a new program of young ambassadors. People who are college educated, who are in their 20s and 30s, who would come and help us with the messaging, who would also work with us in getting the vaccine or being in the study, and that has given us hope. And Bishop, Bishop Watts, I just want to say that what you're saying is right on, because we've been getting messages from the White House, and it has brought this country into chaos. And so now hopefully we can get out of this mess, or at least we don't have to deal with that mess going forward, so that maybe we can help people discern the right message for such a time as this. And that's important.
Well, you all are exactly right. And we've launched a big campaign around Crush COVID-19 across our health system. And we're going to continue to be lockstep with that message. Oniemma, real quick, back on the vaccine, if I get the vaccine, can I still be infected with COVID?
Good question. So what the studies the results that we have show is that it prevents against you having symptomatic disease. So having symptoms of any kind from COVID, and even for those who got severe disease, most of those were in the arm that got placebo. So the vaccine, based on our results, shows that it prevents against symptomatic disease, and for those who get infected, prevents it from being severe. Now, that said, we have, and because of the way the studies were designed, we didn't design it to look at any kinds of infection, both those who didn't have symptoms and those who have symptoms. We're now looking at that, so we'll have some of that data in the future. But we have some data in animals for mRNA vaccines that shows that it also prevents against carrying the virus, even asymptomatically. So we think that, I could confidently state, but we don't have the data, that I'm pretty sure it does protect against asymptomatic infection, but we didn't look at that in the study. So for now, the party line is it protects against symptomatic disease. For those who get breakthrough infections, it protects against severe disease. And we're looking into if it prevents carriage. That's important because, the big question is, if I get the vaccine, does it protect me from even having the virus anywhere, even if I don't have symptoms? Because the question is, can I transmit it to others? So that's an open question.
Thank you. When will the vaccine be available for the general public? And then what about children?
Yeah, so for now, we have the clinical trial went down to age 12. I am currently enrolling 12 to 15-year-olds. So shout out to everyone on this call. If you have 12-year-olds to 15-year-olds, I'm enrolling them now in the Pfizer vaccine trial. We are going to lower that age in the near future down to age 6. Now, there wasn't a lot of interest in the youngest of the youngest because we know, this is, they do get sick, they can transmit the infection, but they don't die from the disease. But now that we've shown its safety in the general healthy population, then we can start pushing it. And we're already talking about even studies in pregnant women. So that's coming down the pike soon. I feel there was a half question there. So it was about children. What was the other one?
It was, when will it be available to the broader public, the vaccine?
Huh.
I know
Yes.
with healthcare workers, nursing homes, there's a phasing in.
Yeah. So there's 20 million healthcare workers in the US. There's, I think, 2 million, or is it 2 to 3 million in long-term care facilities. Between Pfizer and Moderna, through the end of December, there would just be or barely be enough for that priority 1A group, which are, again, healthcare workers and residents of long-term care facilities. Now, both Pfizer and Moderna are committing to making close to, I think Pfizer will be 1.3 billion doses by the end of the year, a couple 100 million of those before June, Moderna probably the same. Now, don't forget, these companies are not manufacturing doses just for the US. There's a global demand for vaccines. So I feel sometimes when we hear about the number of doses, we think it's all for us. No, remember that the US government had secured, a certain amount of doses from Moderna, and from Pfizer, I think it's about 100 million or so. So there's still a chance that even through mid next year, there may not be sufficient doses for every American. And I think that's concerning for so many reasons, because, it has an impact on, the public health measures we're keeping in. When are we ever going to throw away our masks and, stay away? It's still going to be a couple of months. So I think that should still be the package of the message we're taking on, that it's still going to be a while before we reap the benefits of the vaccines to the point where there's enough Americans vaccinated and protected that we can, feel safe and achieve herd immunity.
If I could just add one comment. Oniemma mentioned the pediatric study that's ongoing now. And just again, with this, making sure that we're getting the information out. For any parent who now is concerned about the clinical trial in children, this is the way research is done. First, we develop a confident safety profile in the adult studies. And then there's a reassessment of the protocol. There's a reassessment of all of the safety data. And then a pediatric study is designed. And then there's a separate regulatory approval process that happens when you're doing research in children or in pregnant women. And so there's an extra step, an extra layer. It's called a special population review that happens with the regulatory boards to say, is this research okay in the pediatric population in pregnant women? And so that special populations review is intended to protect, to add even a further layer of regulatory protection to those populations participating in clinical research. And then for the study that Oniemma mentioned, at a certain age, it's not just the decision of a parent. There's also it's called a pediatric assent. So the parents don't just decide that it's okay to have their children enroll. You also need the participation and the commitment of the child to say, hey, I want to do this. And so I just want to add that out there as information, that studies don't just get started in children or in pregnant women, that first we get a solid safety profile, then there's a serious look at that, and then there's a separate regulatory approval process before we can even begin those studies in that population.
Thank you, Tisha. Are there any other comments or messages we want to send to those listening before we wrap up this session?
I just want to put one plug in. It's not too late to get the flu shot. So, we're talking a lot about COVID and COVID vaccines, but I feel like that's a constant message we need to deliver, because, COVID vaccines are not the only vaccines that there are hesitancies around. And so it's never too late. You can still get those flu shots and be a part of making sure that you can have both still. And right now, the health system, every year this time, we have an influx of patients who have other complications. And then the other thing that I also want to say is, because of COVID, one of the things that we've been messaging around in Black and Brown communities, they're concerned about coming to the hospital. Is it safe to come to the ER? And it's really important to even though you're worried about COVID, to know that we've taken those safety precautions, and that if you think that something is wrong physically, you still need to have your regular monitoring of all of those chronic issues like diabetes, heart disease, other things. It's safe, and you need to seek medical attention if required, and you need to stay on top of your preventative care, even with COVID. And I think that those are just really important messages to deliver to our community, especially because we're seeing a delay in seeking care, and that's not good. We have regular healthcare needs while we're battling COVID.
I have a question, Tisha. Can you take the flu shot and the vaccine within within days of each other?
Oniemma, that one's going to you.
How did I see that coming? So in the clinical trial, we separated them out by 2 weeks just because we didn't want you to get a flu shot and the COVID shot and be confused as to which one you had a reaction to. But in the real world, we don't care. You can get them as long as you're feeling fine. You can take, we don't think they'll interact with each other or anything, so just take them.
So Oniemma, you still have the mic, so I'm gonna ask you one last question.
Sure.
If I've had COVID, does it make sense to get the vaccine?
Oh, I love that question. So what I will tell you is that if you've had COVID, the chances of you having a reinfection or another case of COVID within the first 3 months from when you had COVID is, very rare or would be unusual. So if you recently recovered from COVID, I wouldn't necessarily prioritize you. Now, if you're more than 3 months out, and 3% of people in our Pfizer study, 3 out of 100, had asymptomatic infection. So these are people who didn't have symptoms, but when we checked antibodies, when they came into the study, they had been exposed to COVID, but they didn't know because they didn't have symptoms. Those individuals had the same level of protection against COVID. So if you're a distant COVID person, go get the vaccine. If you're within 90 days, there's no harms to you, but you're not necessarily at risk for reinfection.
Excellent. One question just came in. Do we know if those who were included in the clinical trials had underlying health issues such as diabetes or high blood pressure?
35% obesity, 8.4% diabetes, 25% hypertension. So these are people who had the same run-of-the-mill, medical problems that have been associated with adverse outcomes.
Great. Shauna, Sheila, any parting comments from your end before we wrap up? Anyone else from the ambassadors? Bishop Watts?
Just thank you for the invitation, and I think this is just a wonderful forum, and we will definitely, with your permission, be playing parts of it for our community, because I think it's so much information that needs to get out to a very much wider audience, and I'm very grateful for your time.
Well, I think we're just now getting started, and I think as we continue to roll out, as the vaccine gets more available, I know our health system is going to continue to be out there being ambassadors, getting the right information out there to increase the awareness and the importance of getting the vaccine. So thank you so much.
Patrick, how do we get this to other people? How do we share this program?
We are recording it, so I'll connect with Tisha for sure to get that to the ambassadors.
Thank you.
Thank you so much.
Thank you.
Thank you, everyone. Oniemma, anything you'd like to leave us with the last message?
Of course, just to be a little philosophical. So COVID-19 has unmasked a lot of things within our Black and Brown communities. I think COVID-19 has really, been an eye opener, or really brought some things to the forefront that have always been there, but just how critical they intersect with our communities being healthy. So we've talked, for example, about how we consume information. We've talked about the profile of communities of color that put them at increased risk for disease. So I think that when COVID is all done, let's not leave the lessons or the gaps that we've identified. And so that let's continue to chip away about the trust the community has in scientific research. Let's chip away at the misinformation that's spreading within our communities. Let's start to now be on the preventative end of things with regards to just health issues in the community. So let's be the better for it for what COVID-19 has unmasked and revealed.
Well, thank you to all for participating. What people should know is that when I reached out to every individual on this panel with short notice, they all said absolutely yes. They would love to participate, demonstrates their passion and commitment to this work and keeping our community safe. So I want to send a personal thanks to everyone on this panel. And I wish you all health and wellness and a very happy holidays. And we look forward to seeing you soon. Take care.
Thank you.
Thank you.
Thank you.